Hello, this is Tony Hiller from RealClimateScience.com, setting the record straight about whistleblowers. 6 years ago in August, comedian Joan died after some routine elective surgery. This is what the Washington Post reported. What went wrong with Joan Rivers' last medical procedure? Lawsuit. Melissa Rivers has filed a malpractice suit against Yorkville Endoscopy, the New York City clinic that treated her mother Joan for a minor throat surgery last August. The procedure had complications, and Joan Rivers went into cardiac arrest. She died a week later. While the New York Medical Examiner determined that Rivers died from brain damage due to a lack of oxygen, many questions remained about what exactly went wrong during what was supposed to be a routine procedure. Rivers went in complaining of hoarseness in her voice. The suit against the clinic alleges that the doctors at the clinic were reckless, grossly negligent, and wanton, and abandoned the 81-year-old comedian when emergency procedures were necessary to save her life. What ultimately guided me was an unwavering belief that no family should ever have to go through what my mother, Cooper, and I have been through. Melissa Rivers told the AP about her decision to file the lawsuit, which seeks an unnamed amount in damages. The level of medical mismanagement, incompetency, disrespect, and outrageous behavior is shocking and frankly almost incomprehensible. Here's what the complaint says happened. Before she went under anesthesia, Rivers signed a written consent form allowing for surgical procedures, including an upper endoscopy, which examines the digestive tract, and possible biopsy. In the procedure room were Lawrence Cohen, then the medical director of the clinic, and Renuka Mankula, an anesthesiologist. Rivers' personal doctor, Gwen Coravin, an ear, nose, and throat specialist, was also in the room. That is a key point in the complaint, that Coravin should not have been allowed in the room while the procedure was taking place, and B, was not allowed or licensed to perform any medical procedures at the clinic. But clinic staff did not stop her, the complaint alleges. Coravin took the lead and performed a transnasal laryngoscopy on Rivers, which examines the back of someone's throat and vocal box, even though that wasn't initially discussed. The complaint says Mankula raised questions given that Rivers had not authorized the additional procedure, but Cohen ignored the objections and allowed Coravin to go on with the laryngoscopy. The complaint notes that during the laryngoscopy, Mankula had trouble keeping Rivers' oxygen saturation at a safe level, and her oxygen dipped again during the endoscopy. The doctors failed to properly observe and monitor Joan Rivers' vital signs, which were deteriorating, it states, adding that her blood pressure and pulse were also dropping. When the endoscopy was done, Coravin wanted to do another laryngoscopy. Again, a concerned Mankula raised objections. The complaint says that Cohen told Mankula that she was being paranoid. And even though Rivers was sedated at a lighter level after the endoscopy, which left her vocal cords at greater risk of irritation from the medical instruments, Coravin went on to do the procedure one more time. One bit of gossip that circulated after Rivers' death was that one of the doctors snapped photos of Rivers while she was under anesthesia. The complaint alleges that Cohen, in fact, took out his phone and took pictures of Rivers with Coravin. He said that Rivers possibly will like to see these in the recovery area. After the procedure, Rivers began suffering from bradycardia when the heart rate slows down to dangerous levels, and a code blue was called. The doctors also noticed her oxygen levels were dropping, but that none of them ordered, performed, or recommended the appropriate emergency treatment. Also, the complaint says when Cohen finally looked to Coravin to perform an emergency procedure to help the oxygen flow, Coravin had already left the room and abandoned her patient. 12 minutes later, the doctors called code blue. Someone dialed 911 for an ambulance. Ultimately, the complaint states, none of the medical personnel at Yorkville Endoscopy who were present during the procedures performed on Joan Rivers possessed the knowledge, training, and ability to handle the medical emergency. Rivers died a week later at a Manhattan hospital. Medical malpractice in New York hospitals killed thousands or tens of thousands of people this year. So why is this case from 2014 so interesting? It was because a few weeks earlier in 2014, Joan Rivers said that President Obama was gay and that Michelle Obama was transgender.
And do you think that the United States will see the first gay president or the first woman president?
We already have it with Obama, so let's just calm down.
Got it.
You know Michelle is a
I'm sorry, she's a what?
a transgender. We all know.
Oh my gosh.
Joan Rivers was a very outspoken advocate for gay rights and transgender rights, so she wouldn't have been saying this as an insult, she would have intended it as a compliment. She said, "We all know that Michelle is transgender. If that's true, I wonder why other people aren't speaking up too, like she did." Almost everything we hear from the press about politics, climate, viruses, and everything else is a big lie. And yet the lies go on endlessly. Perhaps Joan Rivers was joking. She was a comedian after all. But one thing for sure is that you're not going to hear the truth from the mainstream media, so it's up to independent journalists like Toto to keep the truth flowing. Toto is relentless sniffing out the truth. You can find him on the web at realclimatescience.com.